thanks to an expansion of telehealth services at Catholic Health's Mercy Hospital, women with high-risk pregnancies being treated at the Family Care Center can now stay home and get critical and life-saving services virtually. Joining us now with more on that, Dr. Baraa Allaf, Chief of Maternal-Fetal Medicine at Mercy Hospital. Thank you so much for joining us.
Thanks, Colleen.
First, tell us about the specialty of maternal-fetal medicine, MFM, what that covers.
Yes. Yeah, so maternal-fetal medicine is it's an additional training after the normal regular residency for OBGYN. So in addition to 4 years of residency, we go through a additional training for 3 years, focus on treating pregnant women with high-risk conditions such as diabetes, hypertension, preeclampsia, and also certain genetic disorders, in addition to focus on advanced ultrasounds, diagnosis and prenatal diagnosis in order to treat unfortunate mothers with sick conditions and sick babies.
So before this, before the telehealth expansion, women would have to come in to the Family Care Center to get treatment. But now, like I just said, they can stay home and get treatment from home. Tell us how this all works.
Yeah, well, now more than ever, the telehealth system is needed within the globe and also within Nassau County, and it promotes efficiency of care by helping to reduce cost of unnecessary hospital visits, transportations, and also hospital readmission. So it also promotes and offers the opportunity to address any healthcare disparities and also healthcare barriers, especially during the pandemics where patients have difficulties in transportations or childcare, in addition to fueled by the fear of contacting COVID-19 during their hospital visits. So we are thankful to the Mother Cabrini Health Foundation for providing the support that allows us to provide the patient with innovative technology in order to increase the access to healthcare at home.
So what are the women getting at home?
Once we identify the candidate, woman that is candidate for this technology, patients usually with type 1 diabetes or type 2 diabetes or gestational diabetes that develop during the second half of pregnancy. Patient comes to our office for the first time and then meet with the maternal-fetal specialist, myself, and in collaboration with the Catholic Home Care, we'll meet with the diabetic educator, nutritional counseling. In addition, we'll be given digital devices, including tablets, built-in camera and internet, in addition to glucometers to measure their glucose level at home, in addition to blood pressure cuff and pulse ox. Those numbers are being transmitted digitally to our system.
So it's through the grant, the Mother Cabrini Foundation grant, that you were able to buy that equipment, right, to give to these women?
Absolutely. I mean, traditionally, before the grant, we used to give the patient papers, and the patient needed to go to the pharmacy and pick up their glucometers. They have to chase the insurance company for approval. They have to pick up their test strips and lancets. And then this subjects to an error in transcripting the numbers into the sheets, and it requires the patient to come face-to-face, sometimes on a weekly basis or twice-weekly basis, and make intervention at the time of their visits. So now, with the Mother Cabrini Foundation, Health Foundation grants, it provided us with a grant to give patients the technology needed in order to minimize hospital visits, and also the patient doesn't have to go to the pharmacy and pick up any of their equipment. They can get it right here in our office.
So a lot of women may not know how to use that equipment or how to set that up. The hospital also helps with that part of this too, right?
Absolutely. I mean, we have a person from IT. He's with us all the time in order to educate patients on how to use the technology, and also if they face any problem remotely, they can fix these issues right away.
And once it's all set up, the mom at home is being really monitored 24 hours a day, 7 days a week.
Yes, and which is basically promote more access to healthcare, because now the patient is being monitored on our back end with our home care nurse, who is monitoring the numbers constantly. And when we get outliers, whether hyperglycemia or hypoglycemia, the patient will be contacted, the physicians will be contacted, and action will be taken right away, rather than waiting for the patient to come to the hospital and take intervention, which has really reduced the risk of complications.
And I just, the peace of mind for these moms who are already so worried, it just must be, just must be so good for them.
Yes, they are very happy to have these services. We have enrolled so far 15 patients. We have 15 active patients using this technology. And also, I suspect this is going to be snowball effects. We just began end of March, and we actually just discharged our first patient just a few days ago. This patient came in with elevated hemoglobin A1C up to like 9.5%. We were able to use this technology in order to better control her sugar and minimize hospital visits. We brought down her hemoglobin A1C to near normal, and then she had a healthy baby boy just a few days ago, and she's
Oh,
very happy and thankful.
that's great to hear. So I'm guessing this type of service, you see even more of an expansion for it because it just makes sense.
Yeah, I think it's now with the COVID. I mean, we're seeing expansion of these services, not only for maternal-fetal medicine, but also we're using this technology for patients with certain genetic disorders that they needed to meet with a genetic counselor. In addition to the nutritional counseling, we can do all this from home. The patient doesn't have to take off from work. She can do it and during her lunch break. She doesn't have to take care of child issues, so she can do it right from her house. She doesn't have to go and chase insurance companies or go to the pharmacy to pick up her medications. It couldn't be easier, and I think it will be expanded a lot more in the future.
Oh, well, thank you so much for sharing. This is like you said, we can see this expanding, and it is such a great service helping your patients. I'm sure it's helping the doctors and nurses too. So thank you so much.
Thank you. You're welcome. Thank you.